So, in starting our conversation here, in support of Long Term Concierge, you're really going to be helping execute the essential plan. And with the essential plan, there are, a number of really kind of critical components with that. The starting point being kind of this medication evaluation. So I'd love to kind of just learn more about what that is exactly.
So it is a comprehensive medication evaluation. I will sit there and meet with you, your loved ones, whoever, you as the client prefer in on the conversation, and review every single medication you take. And I tell people this, I want to know every medication you take, whether you take it once a month, every day, if it's in your medicine cabinet, just in case, if it's over-the-counter prescription, I want it all. And the reason behind that is sometimes it's those little pieces of information or medication you don't think to tell me about that can be the one that can be problematic for another medication or with a certain disease process. So it's very important to have the comprehensive review.
Is there kind of anybody that generally would be in charge of kind of performing that, or really, because you're seeing these different care providers, it can be helpful to have, somebody who is dedicated to actually kind of taking this, let's just say 360 view a little bit more holistically, to better understand if there are any potential, negative consequences or interactions with what you are currently taking.
So absolutely. The beauty of having an independent person do that review versus going into the primary care office, which generally that's their job. They like to know everything you take and they'll ask you everything you're taking. But with EMRs, good, bad, or otherwise, those are electronic medical records, sometimes information carries forward or doesn't get updated appropriately, or they assume one provider because they're in the same system, the information is transferred, or even worse, a different provider, they're in different systems. Believe it or not, all of our electronic medical records do not talk with each other. It's astounding, quite frankly. We thought this was supposed to make the world better, and in some ways it has, but it hasn't necessarily. And I will also sit there and say, most people, they mean to be honest with their provider and tell them everything they're taking, but they just don't think of it if it isn't, forefront in their mind, or it's not something they take every day. Like I mentioned, that something they take for pain or constipation or something they take once in a while, and it forgets to be mentioned.
So another critical piece of the essential plan is the cognitive assessment. Just kind of touch on that. What is it, the process that you go through with clients for that cognitive assessment?
We use a standardized tool, either the MoCA, which stands for the Montreal Cognitive Assessment, or something like the MMSE, which is the Mini Mental Status Exam. These are proven tools. They've not been around, they're not new. They've been around for decades. And what we do is ask the questions, we're certified providers to ask the questions, I am, and then we give you a tally. And these tools measure your cognitive processes in multiple domains. It's not simply memory, it's memory, executive function, visual spatial determination. So because certain parts of the brain measure things in different ways. And since it's a standardized test, we expect to see certain scores. And if scores fall out of those ranges in certain domains, we can recognize that may be an early sign of cognitive impairment or a dementia. So here in the United States, roughly 20% of people in their 60s will have a mild cognitive impairment. About half of those, as they age, will advance to a full-blown dementia, Alzheimer's being the most common one. And of course, once people get over the age of 85, about a third of our elderly population actually is diagnosed with Alzheimer's. So the sooner we can recognize that, get people the help that they may need, or just monitor it, know their baseline, the better off that person and caregiver will be.
Great. Kind of a follow-up to that then, is this something that for an elderly person that would kind of generally naturally happen within the course of them visiting their primary care physician, or is there a kind of age, trigger that you look for to say, hey, at a certain point, you really want to ensure that you've had this, this type of assessment done? Just kind of a little bit of a background, whether that's kind of taken in the context of can be taken in the context of the primary care, or if, like with what Long Term Concierge is offering through this essential plan, this is a great thing to also kind of have done independently at a certain point.
So that's a very good question. Most insurances, so if you're under Medicare age, most insurances do not see the value in this and will not pay for it unless you are already showing signs of issues, and then the doctor has to prove that it's warranted, or the healthcare provider.
Sure.
Once you get to Medicare, the primary care doctors very often would like to do it. And not that it takes that much time, but we've all been in our primary care doctor's office. They have a gazillion things to do, and they don't typically have the time, the bandwidth, the staff to do it. So they'll give you what we call a mini cog, a version where they'll just ask potentially about 3 of the questions, and depending how you score on those, repeat it a few months later, and then they may send you to a specialist. So meanwhile, you're losing time. The 3 questions is a great mini screen, but it's not the full screen. So I recommend to most people they do get it done outside of their primary care office. But I don't want to say there aren't any providers out there who are doing it and doing it well. It's just not typical.
Another core component of the essential plan is this medical history summary. I feel in some ways it's kind of akin to the medication evaluation, where you're really kind of taking a step back here. Let's really kind of understand, in a very complete way what's happening here. So, just what is that medical history summary that comes with the essential plan, and then, kind of the process that you go through for that.
So again, it's a very brief but comprehensive summary of your key medical diagnoses and procedures. The reason behind that is twofold. Every physician that you go to, any provider, nurse practitioner, PA, whoever, will want that piece of information. If you go in with too much information, again, because of the time constraints, some of that may not get reviewed or dismissed. And I will tell people, I've worked in provider's office where the people are so great. They bring in records like this, and the records get put aside and don't get looked at.
Sure. So
it's too much information. Conversely, I've had people forget, if you had your shoulder surgery, 20 years ago, you may dismiss it. If you don't know why you take a medication, my doctor prescribed it for me, and you don't know specifically that it was for atrial fibrillation or hypertension. You sometimes may forget to mention you have a history of those. Or another example I like to say is I've had many people tell me, I don't have high blood pressure, I don't have depression, I don't have anxiety. But clearly I look at their medication list, and they're taking several medications for those. And it's not that they don't have them, they're just well controlled. So it's important that that whole picture is shared. And you were very astute in saying it's very similar to that comprehensive medication review.
And I think then some of the value would be you as a professional have a clear understanding of, okay, here are the comprehensive medical records, but in reality, probably a subset or, summarized version of that is what is going to be most valuable to any, medical professional doctor that you may then be seeing.
That is exactly correct.
So then just kind of wanted to talk about, some key challenges that you've kind of experienced working with the elderly, and then, potentially some tools or resources to help, not only navigate their challenges, but for somebody who may be in, a caregiving situation, how that relationship may be able to kind of be most successful.
And I'm going to emphasize that I think working with older adults is the best thing. I chose to do it, way back in my 20s, and here I am, obviously decades later, and have loved every moment of it. So it's more rewards than challenging. I will say that completely. That being said, like everything, it does come with its challenges. Older adults do tend to have multiple illnesses, comorbidities is what we call them. And sometimes weeding through all that and trying to prioritize can be a challenge. The prescribing cascade, sometimes we see people taking 10, 15 prescription medicines and another dozen non-prescriptions on top of that. If you can imagine keeping track of that many pills, and sometimes we get to a point where we're more often treating the side effects of the medication than we are the disease process and the person themselves. That's another challenge. Frailty. The reality is, even if you take care of yourself to the best of your ability, as we age, we get more frail. And that becomes a challenge, whether it be mobility or some cognitive decline, all of that, which, of course, caregivers then have that extra challenge to help mom, dad, sister, brother out in those circumstances. Family members, most of the time, they are there and they want to do the best by their loved one, but it can be difficult. You're not in 100% objective situation, right? You're that daughter or son, or, as I said, a sibling, or even a parent. So those are some of the challenges that come from the caregiver perspective and from the older adult perspective. So fortunately, we are in a great day and time and age of having tools and resources available. That is one of the reasons, quite frankly, I love Christina's long-term care concierge services, long-term concierge services. The playbook, for anyone who has not seen it yet, it is very comprehensive and it can be tailored to the individual. And it's all about being prepared. We all know preparedness is much better than acting in crisis. When you have to be prepared for some of those what ifs. Doesn't mean you'll ever have to enact the plan, but it's so great to have it if you do, and to know where to get the information and where to go. Care managers, if you need that personal touch, they are worth their weight in gold. So that's almost like a private social worker or nurse who will help you through every step of the process. They're expensive, but they will be there for you. So those are other resources.
I really appreciate your time today and sharing your expertise with us.
Well, thank you. And thank you for talking with me. And everything you said, I would like to echo. It really is. It's not a burden being a caregiver, but it can be a full-time job. And if you already have a full-time job or other responsibilities, it can be overwhelming. So as you said, having that objective party to help you so you get the best outcomes, that's exactly what this is all about. So that's great.
Yeah, that's great. Thank you so much, Patti.
All right. Thank you.